I would say that everyone at some point in their life has a digestive issue. So in this video, we're going to go over all the digestive issues that you need to know about. We won't be talking about some sort of rare issues or anything like that, or if you just get a funny episode of diarrhea after eating a little bit of odd food, but more defined digestive issues. So we're going to go head to toe, the entire GI tract, talking about the 9 digestive issues, gut issues that you really need to be aware of and that you need to know about that cause a lot of the symptoms that we experience on a day-to-day basis. I'm a family medicine doctor, and if that kind of stuff interests you, then smash the like button and subscribe. On this channel, we talk about medicine and lifestyle. So let's jump right into the video and talk about these 9 digestive issues. But before that, we need to talk about the digestive tract naturally. What is the digestive tract? As well as a few caveats. So we're not going to be talking about acute issues like appendicitis, really urgent things like when you eat some bad food and you get some diarrhea. We're going to be talking about defined digestive issues in the digestive tract, meaning we're not talking about the liver, the pancreas, the gallbladder. These things we'll leave for another video, as well as we're not talking about some sort of rare diseases and things like that. We'll cover that in other videos. Let me know in the comment section what topics you'd like me to cover. So what is the digestive tract? First and foremost, the digestive tract is essentially a long tube that starts from the mouth and it ends in the anus. It's responsible for breaking down food into nutrients that can then be absorbed by the body. And then along the way, there's various organs such as the stomach, the small intestine, the large intestine, and these all play a very crucial role in the digestion process. The digestive tract is also known as the GI tract, as you saw in the title of the video, and effectively starts at the mouth, ends at the anus. So that's the anatomy of it: mouth, esophagus, stomach, small intestine, large intestine, anus, and then it ends up in your toilet. So what are these digestive issues? Let's first talk about some of the symptoms that you may experience, because a lot of them can overlap. So you can have diarrhea, constipation, gas, bloating, pain, and reflux. That's the first one we're going to talk about, reflux, because a common condition that a lot of us can experience is commonly known as reflux or GERD or gastroesophageal reflux disease. So that's the first thing we're covering here, the first condition on our list of 9. And this is affecting the stomach and the esophagus. This occurs when stomach acid flows back up into the esophagus, and then it causes a burning sensation in the chest, acid reflux or heartburn. Other common issues can be bloating, gas, even constipation and diarrhea. And we treat this with acid blockers, or maybe lifestyle can play a role here as well. If you leave it unchecked and unmanaged, it can result in Barrett's esophagus, where the cells of the esophagus change and predispose you to cancer. So that's not good. The next condition we are talking about is hiatus hernia. This occurs when part of the stomach pushes up into the diaphragm, because the esophagus goes through the diaphragm and turns into the stomach. This is when the stomach pushes up into the diaphragm and forms a hernia. So some people with a hiatus hernia may also experience reflux type symptoms, where the stomach acid travels back up into the esophagus, causing heartburn and irritation. In some cases, hiatus hernia can be managed with lifestyle changes such as avoiding trigger foods and losing weight. In more severe cases, surgery might be necessary as well. But effectively, it's like a hernia like anywhere else in the body, and it pushes through, as you can see here in this picture. So that's a hiatus hernia. We need to be mindful of that. Helicobacter infection is the next one. So it's a Helicobacter pylori. H. pylori is a type of bacteria that can infect the stomach lining, and this then causes peptic ulcers to form. Now, if you leave that untreated, H. pylori infections, they can lead to other complications such as more prolonged gastritis and even stomach cancer. The symptoms once again overlap: pain, bowel changes, nausea, and a lack of appetite. So this is a problem because we need to treat it. Otherwise, you will feel more and more unwell. And the way you generally treat it is with a combination of acid blocking tablets as well as antibiotics. So generally, it's a few weeks that you take it and you get rid of it. Now, that's not the only cause of peptic ulcers. You can have peptic ulcers as a result of certain medications, lifestyle factors, genetics, and other conditions as well. So that's a peptic ulcer. The next on our list is celiac disease. A little bit less common, but still. common enough and well known. This affects the small intestine. So we are moving now down the digestive tract. So this is where we have gluten. It's a protein found in wheat and barley, and the issue is triggered by consumption of gluten, and it results in a inflammation of the small intestine. So gluten is a protein found in wheat, barley, and rye, and it gives you again a similar picture of symptoms. Now, this can happen in the young and it can happen in the old. In the young, it gives you a picture of a failure to thrive, right? So the child doesn't gain weight and things like that. The way to manage this, the only way to manage this is with a gluten-free diet. This disease is very important because gluten sensitivity, intolerance, and things like that is very common in mainstream, but there is a clear difference which we'll cover in another video. IBS is the next one, irritable bowel syndrome. This is extremely common. So it's a chronic, relapsing, and remitting condition of unknown cause. It's a diagnosis of exclusion. So when you don't have any other digestive issue, it cannot be found the reason for it, then we can say it's IBS. What is it? I mean, it's a functional disorder of the digestive tract, and it presents in a way of ABC, abdominal pain, bloating, change in bowel habit. Now, why does this happen? It's a bit unclear. Is it a question of visceral hypersensitivity, where the organs are more sensitive to pain, so the pain threshold is lower? Nonetheless, it impacts people's quality of lives, and they're quite unpredictable and can impact the quality of life. Now, the ways to treat it: fiber bulking agents, antispasmodics, a whole load of medication. I would rather prefer to focus on the lifestyle aspect, so diet, nutrition, mental health, and these kinds of things to manage something like IBS. Inflammatory bowel disease, very different to IBS. IBS is a pain threshold kind of a scenario. Inflammatory bowel disease is, as the name implies, inflammation. We don't know why it occurs, but it's thought to be a result of an environmental trigger on genetically susceptible people. It's chronic, it's relapse remitting, it's an autoimmune condition. You can put it in the category of that. The two most common ones are Crohn's disease and ulcerative colitis. Ulcerative colitis affects only the large intestine, so we've moved now down the GI tract furthermore. Crohn's disease, though, is a bit different. It can affect any part of the GI tract. What is the GI tract? Anywhere from the mouth to the anus. So Crohn's disease is tricky in that sense. It can present then, inflammatory bowel disease, as a host of symptoms depending on which part of the GI tract is affected, and it's very complicated to treat. Again, we'll cover it in another video. Diverticular disease. Check out our other videos on diverticular disease, but effectively what that is it's a formation of small pouches or sacs in the colon wall, and that is a problem because there's a lot of traffic going through the colon, there's a lot of pressure there, and if you don't help it along in the sense of eating lots of fiber and drinking lots of water and not eating as much processed food and things like that, then they can become inflamed, these pouches, causing diverticulitis. And this causes pain, bowel change, blood in the stool, and fever. Check out our other videos regarding diverticular disease to be more aware of that condition. Then we move on to an even more common condition, and this is called hemorrhoids. In other words, piles. So they're those small little skin tag looking things that pop up around the anus. So they're common in all age groups from the teens and onwards. They are distension of the veins around the anus essentially. And then because they're so localized there, they can cause discomfort, a feeling of incomplete rectum, bright red paper on the after wiping, and they are a result of a lot of risk factors. So constipation, lack of fiber, family history, varicose veins, pregnancy. So lots of risk factors. The way to treat it is generally with creams. If it's more problematic, then it's surgery. As you may notice, there's a lot of themes here. So a lot of it's where medication can treat it, but I think you can focus on the lifestyle and get by as well. Then the final one is cancer. So the digestive tract cancers are very, very important, more and more prevalent in the younger populations. What is cancer? Cancer is a group of disease that's characterized by abnormal growth and spread of cells in the body. So generally, it's a complex combination of genetics, environment, and lifestyle. But effectively what happens is that traffic light system, that the regulatory things that your body has to keep cells from spreading in an uncontrollable manner gets cancelled. And then it's wild growth, and that's effectively cancer. It can happen in any part of the body, and that's a big, big problem. When we're talking about the context of the GI system, though, If you do notice any of these symptoms going on for a little while especially, then you have to get in touch with your healthcare provider and get the proper checks in place. So that's when it comes to cancer. Very, very important, can affect any part of the body, and it's more and more common in the younger population, so that's not good. There we have it. Those are our 9 conditions, our gut conditions that we need to be aware of, that we all need to be mindful of. Please let me know your thoughts in the comments below. Let me know what topics you'd like me to cover. Like and subscribe for more. It really helps the channel, and we'll see you in the next one.